So let's talk about fracture points and what is fracture first of all. And fracture is nothing but a broken piece inside the bone. That's all. And it could be a hairline fracture or an entire fracture. So that's the thing. Hairline fracture, it is mainly a thin line which takes some time to recover but is not completely chipped away. So that's an hairline fracture. And normal fracture in general, whenever we're talking about fracture, then one thing that comes, the bone is exactly separated. So two type fracture you hear over here, and as well, I mean there are a lot type of fracture that occurs, and every part of the fracture has its own different name and everything. So that's the thing. Whenever we are taking an x-ray of our leg and x-ray of our knee, then the most general thing that you will see here is the femur, the tabula, and the patella. Three bones are present here: the femur, the tabula, and the patella. Now patella is the round balls here, and femur is the thigh bone, which is one of the most strongest bone in your body because it is so much dense. And whenever you want to see if the bones are, the joint between the bones have decreased, or they have dislocated, or they have done something, or they are exactly broken or something else, or an outgrowth had occurred between the bones, so how would you identify all of these things? To identify this thing, you will first need to have the x-rays. X-rays from two different angles, not necessary, but both of the foot are necessary. So take the frontal x-ray of the leg, both leg, left and right, and you have to compare both. If both are having problems, then comparing it with your own knowledge is the right thing, and if only one is having issue, then comparing with, if the right is having issue, then comparing it with the left could help you understand the problem as well. Now whenever you're looking at the x-rays, you have to see the distance between the joint. Is it too much, is it too less? You have to take into care that if it is too much, then elongation has occurred, which should not occur as well. And elongation doesn't rarely occur, but it may occur. Also, the distance decreases, it is one of the biggest problem. And calcification also occurs. Calcification of the cartilage inside the joints also occurs due to the deposition of calcium there. So lots of thing occurs here, but when the distance between the joint decreases, then it looks like there's less distance between them. That's a common thing you should know. And due to the less distance, it hurts a lot. And this is how you identify this type of thing. But whenever we are talking about all of these things, we also want to know how to know if there is any sort of dislocation. To know if there is any sort of dislocation, you do not have to do anything. Just see, because your body is so symmetrical, there are no random jumps inside the structure of bones. So if you are going through a smooth surface of the bone and there is a sudden bump, sudden groove, sudden increase in the length, then you can say it is a fracture or it is a disjoint, dislocation. So that's the thing. It's the beauty of our body that we know everything is so symmetrical, and due to it being so symmetrical, any sort of high jump between the structure, it lets us to know that it may be a broken one, it may be a fractured one, and it may be not a good one. So that's the thing. And looking at everything, everything part of your body, then to identify everything, first of all, cartilage, they do not come under x-rays, so you have to take into care of that as well. Only bones and fluid come under x-ray, and other type of thing like metals and everything, they also come into x-rays. You do not need to wear metals. That's why the first precaution that is given to you during x-rays, before you getting x-rays, are you should not wear any sort of ornaments on your body. That's the thing. And also one should not be in range of X-rays again and again, because these are type of radiations which can destroy our cells. If getting through X-rays a long duration, you are being possessed, you are being under the X-rays, the radiation for a long duration, your cells may be destroyed. You do not want that. So that's why you should keep your body strong and do not go under that again and again. That's the thing. Thank you.